Hi there. Welcome to the Lifestyle Herbalist podcast, where we hope to bring you a healthy dose of happiness. I'm your host, Dabney Vaccaro, clinical herbalist, health coach, lover of plants.
And I'm Sabrina Cooper, registered culinary holistic nutritionist and herbalist. Join us as we dive into the art of herbalism, mindfulness, and healthy lifestyle practices to help you achieve a happier and healthier life. Whether you're a seasoned herbalist or just starting your wellness journey, we're here to provide you with the insights, tips, and inspiration for a more balanced and joyful existence. So grab your favorite herbal tea, sit back, and let's get a healthy dose of happiness together.
Well, welcome back. Today we have Dr. Cassie Parker, who is the owner of Resilient Wellness and Physical Therapy. She has an office in Loveland, Ohio. And Dr. Cassie is a holistic women's health physical therapist and is an expert with pelvic issues. And I have to say, for me, I had an appointment earlier this week because I've been having some lower back pain. And we met online because obviously I am not in Ohio, I'm in Virginia. But through the technology that we now have, we were able to have a wonderful meeting, and she took me through a series of exercises, gave me homework with a follow-up email. And I have to say, this morning I was just relaying to her that I'm able to touch my toes without that sharp shooting pain that I used to have. So anyway, we're really excited to have Dr. Cassie here with us today to jump into women's health and why it's important to not ignore the pain that we have. We should be able to enjoy our life pain-free. So welcome, Dr. Cassie.
Thank you. Thank you. Glad to be here.
Awesome. So can you share a bit about your journey into physical therapy and what led you to specialize in women's health?
Yeah, I think I am a pretty traditional physical therapy route where I was an athlete, and that just drew me to wanting to work with, say, athletes or in the physical therapy realm, right? I sprained my ankle, so I went to physical therapy. And I pretty much ruled out what I wanted to do for my job because I was like, I don't want to wear heels and I don't want to sit at a desk all day. So what else can I do? My mom was a nurse and I definitely knew I didn't want to do that. And so, yeah, that just really narrowed it down. So that's going way back. So I had a pretty clear path to like physical therapy and wanting to help relieve, pain because I experienced pain myself. I had a car accident when I was 15, and I also, again, just played collegiate soccer. I was a soccer goalkeeper. So I joke, I pretty much willingly threw my body on the ground hundreds of times a day. So I had some chronic pain, although I didn't have like injuries to where it was like, okay, well, do this and then, get you back and kind of recover from the injury. It was just that chronic underlying pain. So fast forward a little bit through PT school. I actually, interestingly enough, I really studied neuro, working with like the stroke population or people with spinal cord injuries. That's what I thought I wanted to spend a lot of time doing. And I came out, I worked in the hospital for a little bit, which was great. I learned just, like on the fly, everything medical related, because you've got to coordinate with everything, all the other services. But then, I got burnt out working with the neuro population. You just see a lot, of just hard stuff day in and day out. So I needed a break, and that moved me to a small clinic. And it was an outpatient clinic, and it was a family-owned clinic, and just like a great piece of the community. So I had a wonderful mentor. She had been practicing for about 40 years, and just had that holistic perspective, right? Because she had been in it so long that she realized, she was connecting the dots of like, it can't just be that you walk in with knee pain and we, have you activate your quad and your hamstring and then you walk out with no pain. That's not really how that works in our brain. And so she really would approach her patients with a lot of the, they would come with that, like, we call it fear avoidance, right? Where it's like, you're fearful to say, do a squat if you have knee pain, and you're kind of hesitant. And she would just give that extra vote of confidence to kind of take someone over that hurdle of doing something they notoriously haven't been comfortable doing. Because she realized, she had to be the confidence for them, and then they would, she would be like, see, you did it, and kind of hold their hand a little bit through it, which was great. Cause you're not really taught that stuff, that like personal touch and like what's behind the pain in PT school. So just wonderful mentor. She taught me how to just like make someone comfortable in the environment, comfortable with like, make sure they are comfortable on the table, get them to relax, things like that. So gathered a lot of information from her. Fast forward a little bit, I had my babies, and that's kind of when the world of like pelvic health PT was just like blowing up. Like I would just, things were, people were coming out of the woodwork talking about pelvic health. And again, I got a blip of it in PT school. It was not very much at all. And so I was like, you know what? I feel this. I've been through pregnancy. I've been through childbirth, and I want to know more about this. And so that's just, I'm just kind of like following my own path. I would say before I jumped totally into pelvic health, I also was still trying to heal my pain that I'd had since I was 15 years old. And this was tension headaches daily, mid back pain daily. And it's the kind of pain that just makes you feel like a tense knot. That combined with entering into motherhood, feeling like you're in a tense knot, was not a good combination. And it was not a good combination that I had to kind of put on a mask every day and tell my patients, oh, I can help heal your pain, yet like I'm in pain.
Right.
So that was like probably the biggest shift, because I just realized that then, and I think this happens for a lot of practitioners too, is you are like telling your patients to do these things, and you're seeing the relief on them, and you're like, well, who's going to take care of me? Right. And I'm giving all of it to you. And then I go home and I'm with my husband and my baby, and I'm just like stretching for 2 hours when I get home, because I can't do anything else because I'm in pain. I can't play with my, little toddler going around, and I can't do the things that I want to show up like I want to be able to do, because I feel like I'm giving it all away throughout the day. So I knew there was a better way than that, right? Like I knew that like I'm kind of the quote unquote caregiver as the PT. If I take care of myself, then I'm going to take care of my patients better. So I went down the rabbit hole of really trying to understand how chronic pain works in the brain, and found out through my education that things like whiplash increase your sensitivity in your body just to feel pain, and things like trauma, little t, big T, whatever. Trying to name jaw pain, really any head injury. Really what it does is it just upticks your nervous system so that your threshold for pain is a lot lower. So I realized that a couple of and ironically enough, I had a head injury when I was like 2 years old too. I don't know. So my sensitivity to pain was so much higher than the normal people walking the earth. And I think like those are the things that I'm like, okay, I can accept that. And that makes me feel a little bit better just understanding that concept. And also just pain pathways just totally solidify their wiring and their pathway in our brain. So anything related, if you're thinking like, this is the most common thing I get in the clinic. If you are, if your pain has gone away, like say Dabney with your back pain, if your pain has gone away, but then you're like, ooh, I just don't want it to come back. And you're kind of stuck on that. When is it going to come back? You're actually playing back into your pain pathway.
Right.
Doing
right.
Just
the mindset. Our mind is so powerful. You're right.
So anyway, long story short, I ended up merging. Then I went women's health because I was like, pelvic health is kind of the source of chronic pain, the source of trauma for a lot of women, the source of big changes, whether it's pregnancy, childbirth, even like preteen, right? Like starting your cycle and all the hormone things that are happening there. So it's just the source of a lot of changes in our body that makes us completely separate, from the male. And I wanted to know more about that. And I'm so happy because I really understand the differences of the stress that are put on women's bodies at this point. So I feel like I have all the tools to help women. So.
Yeah, that's awesome. And we need more practitioners to really focus on women's health, because our medical industry has really focused on men's health, and recommendations have been made based on men's testing and laboratory work, not so much women's, because our hormones do play, a pivotal point in how things regulate for us. So thank you for really being an advocate for women's health. As Sabrina and I are certainly about women's health as well. We've cultivated a number of teas and things that really help balance hormones and just the stress and day-to-day self-care things that we tend to push off.
Mm-hmm.
So, yeah.
Absolutely.
So what unique challenges do women typically face when it comes to like movement health, and how do you address those things in your practice?
Yeah, well, you already mentioned hormones, which I think is a huge play into, the fact that we cycle regularly. We have that monthly cycle, and then it's affected again when you go into pregnancy and maybe have a baby, or it's affected when you're perimenopause or in menopause. And so we just have to really we have to work off of those cycles, whereas men can kind of just live there every day about the same.
Great.
So, and we can come back to talking a little bit more about hormones. I know women are really, really interested in that. But the other thing that, is not really talked about is just purely the shape of women's bodies are different than men. And this is something that we're taught, through PT school and taught in the, to appreciate. But I don't think it's really talked about much in the public, is just purely the fact that women are more hourglass shaped. There's different stresses put on their pelvis, their knees, their ankles, even up to their head and neck because of that shape. Whereas men are much more straight up and down. So things like hip bursitis, like tenderness in the outside of your hip bones as women, is very common. And that's going to be an extra stress because of the hourglass shape. But then, I do see some men too. I always joke. I always see the husbands of my female patients. That's the men that I see. But then, there are actually some diagnoses that, in some areas of pain that I see more in men too. So, I get a good view of, oh, I see this on repeat with women and I see this on repeat with men. So, it's just important that we know the differences. Like, I think that should be a foundation that every physical therapist should really, truly understand the differences, because it's going to immediately affect your ability to diagnose and see that origin of pain in that person. And then so that's a really, really big part of the physical. But I mean, what I would say, and what makes me, I think, really good at connecting with women is understanding that we are ingrained to be caregivers and take care of I always say, we're the heart of our home and our community. And then we're pushed in a world where we're also pushed to be leaders, and we're pushed to be, you know what I mean? And there's just kind of step up as women. And so we're still juggling all of the responsibilities that we have in the home. And I think this really affects, my generation, because it was like, oh yeah, no, we're going to college. We're working outside the home. We're doing all the things, where my mom was still kind of in the in-between. She worked part-time, and she, was at home part-time, and she had a really nice flexible schedule. Now it is, there's got to be two working parents. You've got to find a way. And so there is just so much stress. So I would say the main age group that I work with are women, I'm going to say 30 to 60, usually I say 40 to 60, but 30 to 60, who also have the qualities of very resourceful, like a go-getter, like, okay, just tell me what I got to do and I'll get it done. And so they challenge me, which is great. And what I help with them is connect that if you're living in a world of anxiety and stress and overwhelm, but then trying to cure pain, that's not going to work. We have to address, and sometimes I'll resource out if I really think they need mental health therapy. I'll do like an anxiety depression screen with them, or, so that's helpful for them to be able to know kind of what box to tick first. And so that particularly, I mean, we can all see the woman that's just like rushing in. Oh my goodness, I'm sorry, I'm late. Like I had to drop my kids at school. I had to like make this quick phone call, right? And then she walks in and I'm like, okay, but first we have to breathe, and because we're not going to get anywhere. And so I feel if you don't appreciate that, you're like hitting a wall, right? If you're not making a woman feel comfortable, feel calm, feel relaxed before you're then going to ask her to make a change in her body, that's not going to work, because we are, the women I see are highly compensated too, because they've kind of left this and their body has figured it out, right? They've left this for so long and their body has figured it out. So again, we find a way to figure it out. That's just what we are. We're fixers, we're caregivers. And I would say the one other piece to that is I see so much guilt with women who they're trying to juggle quote unquote self-care, which they see as removing themselves from the family, removing themselves from the community and focusing on self. Whereas most women get more energy and more joy from actually that caregiver role than going out and getting a manicure or going out and getting a pedicure.
Thanks for tuning in. I wanted to let you know about eCornell's plant-based certificate program. Enrolling in the eCornell plant-based certificate course is an excellent way to deepen your understanding of nutrition and its impact on both our health and the environment. Personally, this course helped me realize just how crucial food is to our body's well-being and why we must carefully consider what we eat. It's grounded in science, and the course provides evidence-based insights into the role plant-based nutrition plays in supporting optimal health. It also highlights the environmental and sustainability aspects of our food choices, making it a comprehensive resource for anyone looking to better understand the broader implications of nutrition. I highly recommend this course to anyone wanting to gain a solid science-backed foundation in plant-based nutrition. Check out the link below in the show notes for more information. Now, back to the show.
Yeah. So they feel this frustration and overwhelm when they have to caregive in pain. But as soon as we take the pain piece out of the way, they're able to enjoy that caregiving again, and they can show up for their family, and they can still, do all the things, hopefully not all the things, but do the things pain-free. And that's what actually is healing to them. I'm never asking a woman to say, hey, you need to schedule this 60-minute massage and you need to do XYZ, because I know that that sensation of like that guilt of like, man, but like, I do want to eat dinner with my family tonight,
Right. Right.
So,
yeah, it's one thing you said earlier, about understanding the body types. I'm looking for like a pair of corduroy pants, because I think they're cool, and corduroy is kind of back in, but it's hard to find women's corduroy pants. Men corduroy pants are everywhere. And I was shopping and this fellow says, well, just get a pair of men's. It's like, I'm not getting a pair of men's pants. Like, they're not going to fit right. Clearly, he had no idea that there's a difference between a body of a woman and a man. I mean, they're just not going to fit the same. I'm sorry. That's just not going to work for me. Thank you.
But the boyfriend jeans are back in too.
Exactly, right.
I don't know. Maybe.
Yeah. So maybe I should have given it a try, but I just dismissed it immediately, thinking that's not going to work.
Yeah. Yep.
Yeah. Yeah. And as herbalists, like Sabrina and I work with herbs that are really great to help with tension. And you were talking about those patients who come in who are just, really tense. And so there are herbs certainly that can help mitigate some of that nervous energy. And we were talking about head and shoulder and just head injuries. I kept thinking about wood betony. Wood betony is the go-to herb for people who've had past concussions or head trauma or things like that. So certainly there's some herbs that can help intertwine and help with that as well.
Right.
It was
Yeah.
interesting how you said about the concussions and making mental health worse, you know, like, or it like acts in your brain, like all these hits and traumas and everything, because I see that in family members and myself as well, like falling and hitting head, that you're more sensitive to certain things. And we had a family member as well who had suffered a couple severe concussions and seemed like the mental health exuberated, and then different ailments started coming out of that, aches, shingles, different things. And I feel like that was all because of the mental, like hitting the head. And so I just think it's interesting that you said that it really plays a role in all of your health, right?
Yes. Yeah. And I use something that's actually, it's a proven outcome measure. It's called the Central Sensitivity Inventory. And so central sensitization is actually the level at which, how do I say this? The amount of sensitivity that your brain has for pain. So your brain will only alert pain if the injury is worse than like your outside sensory. So think of, like, I once treated a man who broke his ankle and had to hike out. It was in Virginia, had to hike out of the mountains 6 miles.
Wow.
And he did not feel his broken ankle very much until he was out and he was safe, because he's like, it can't be dark and I still be left in these woods. So that's the power of the brain. So we also have to think of it at the opposite, as, if someone has experienced trauma and that wiring is in their brain, maybe they just get a little blip of, there is a book, I can't remember exactly what book it is, but basically, say this guy was like, it's like just like a good story. This guy was walking through a field and he got bit by a snake on his leg and almost died, right? But he lived. And then he told the story of, he was walking through grass one day and the blade of grass just grazed exactly where he got bit by the snake. And he went down and his body had the exact same reaction as he did when he had got bit by the snake. So, the body remembers, right? And most people know the book, The Body Keeps the Score. The body remembers as a protective mechanism. And so this CSI, this outcome measure I'll have people do, what it does is it gives me a number of how sensitive their system is to pain, dependent on external factors and internal factors that have happened to them in their lives, past, present. So that it just allows me to kind of know what I'm starting from, how much I can push them, how much I need to really respect their pain. And I think that that's often missed with people, because we kind of treat everyone the same as far as how they feel the pain and what it's like to feel pain in their body. Only they know that. So important.
Yeah. And I think, like, too, what you were saying, like, you said something about like your brain remembers, and then you get fearful that it's going to happen again. And you're feeding that pain. Right. And so I find that with my mom, for example, she's 80 and she's now getting weaker because she hasn't, over COVID, destroyed her in that sense. She was home. She was fearful. She didn't go do exercise. She was doing Zumba walking before. And now she's like lost a lot of that muscle. And I count it to that, but she feels really weak. So every time now she goes up the stairs, she's fallen a few times. And now she's afraid. And now every time she's like, I can't do anything. I'm weak. I can't. But then if she puts it kind of out of her mind and forgets, she's fine. Like, not that she's fine, but she's able to do it. But she's even fearful now to go to church, which is a big deal because my mom is like every Sunday church person. And now she's afraid to go to church because she's afraid that if she sits too long, she's going to be like, get up and walk and fall. And she doesn't want to make a spectacle of herself. And so, it's trying to retrain her brain. I'm like, what if we do this? Or what if we go together? Or what if, no, I'll be fine. I'll just sit here. But so it's interesting how you say that, because I could see that happening with her.
Yeah. Yeah. And that's what, a lot of times the family members are like, I see the change in this person. And when you start having to give up those things that bring you joy and kind of make you who you feel you are, like, I'm sure that's how I'm like, yeah, I go to church every Sunday, that's part of me. And so having to feel like you have to give that up it just kind of steals your light. And I think that's pretty much one of the biggest things that motivates me, is because I want everybody to be able to keep every good part of themselves, and then be able to like affect other people. And that's part of the reasons I love working with women, and really, really hone in on that, is because I'm like, if I can take care of the woman, her light shines the brightest to others, and that's going to make the like most positive impact in just the community that I live in, and just in general. And not to like say anything, about men. I love men too, but I mean, women are the light of the community, usually in the family, so.
Right. Yeah.
Yeah.
Yeah. So what challenges do women through the ages have? Like a 30-year-old certainly isn't going to have the same challenges as say a 50 or 60-year-old. So what are some things that women should look out for, and when is a good time to call you to help for some help? Because I know for me, like, I think I waited too long. Like, I kept thinking I can exercise this out. This is going to get better. I'll just keep doing, my herbs. It'll be fine. But clearly I needed more help.
Yeah. Well, and I think, and that's part of, I would love to say, yes, it is much easier for me to work with a younger woman who has not been, not so much from like even a strength or hormone, field of view, but even the fact that like those compensated patterns I was talking about, like she'll find a way, haven't been as ingrained. So we're not having to break through and retrain as much. But also, I will say, just from my standpoint, I love working with women 40 to 60 because if they've had kids, their kids are a little bit more grown up. They're starting to get back a little bit more time for themselves to be able to invest in their health. So their capacity to actually put into play what we're working on is much greater than, say, the 30-year-old woman who's juggling 2 kids under 2 or whatever it may be. So, I always meet my patient where they're at, and see what their capacity is first to making the change and what their commitment level is. Because I don't just take people, and I'll talk a little bit more on like specific diagnosis for age groups, and point out a couple things. I don't just take people through pain reduction. We take it all the way to retraining your body. And then our last step is that resilience. So we make sure that you're going to stay pain-free, even if something crazy in life comes up, right? If you have to, or if you're going on a 12-hour drive to Florida or whatever it may be. So some people aren't ready for that. Some people are just like, I just need to done after the pain relief. I'll try my best. I'll come back and see you whenever I have a little bit of a spike of pain. And that's when I will have them, I'll be able to just tell them, okay, when your body is not able to do this, you need to come back to see me. And a lot of that is actually just real easy things that you can check. So I would say some of the biggest diagnosis for like my younger women, my 30-year-olds is, we basically, it's, I'm trying to put that, I would say pelvic pain. So that is constipation, pain with intimacy, or any sort of like, hip pinching, like pinching deep in the hips. Those are, and low back pain. Everyone across the board has low back pain. That's just an easy one. But that, all of those 3 things that I mentioned, constipation, I would say low back pain, and like hip pinching and deep hip pain, are all signs of a, too tight of a pelvic floor. And so, we don't talk about constipation enough, but constipation is absolutely, if you're pushing against a tight pelvic floor, you're not going to be able to, go all the way, and you're going to get hemorrhoids, and those things are really amplified during pregnancy and things like that too. So that's what I see most in the kind of 30-year-old age group. Fast forward to 40s, women are usually getting back into their routines, their exercise routines. So there might be, jumping on the train of lifting heavy, which is really, really great for lean body mass and hormone regulation. You really want to bank up as a woman because that increases bone density too, in your 30s and 40s for later in life. So a lot of my 40-year-old women are getting in the gym and lifting heavy. And what I'm seeing there is just, they feel it all in their back and they feel nothing in their core. And their hips are really, really start to get really tight and sticky. They are just constantly stretching their hamstrings and their glutes. And that, Dabney, a little bit, that is mostly due to the position that their pelvis is still in, usually as a result from pregnancy, but also things in our general environment put us in that misaligns our pelvis. And so they're not fully recovered potentially from having a baby. And now they're lifting super heavy. So the rest of their muscles are not doing the correct job. And those muscles are really getting super tight. So IT band, tenderness and tightness, piriformis syndrome, sciatica, things like that, just really, really, really tight back muscles, is usually what I see about that age group. And then fast forward a little bit, when your estrogen starts to decline, you start to lose, strength and bulkiness of the tissue in your pelvic floor. So you get that weakness in your pelvic floor. And that's when we start to see, if not before, some of the incontinence, and you are more apt to get like the hip bursitis, so the tenderness on the outside of the hips. That's one of the main things that I have kind of my 50 to 60-year-old and above age group is they are like, I turn over, I cannot sleep on my side. It hurts my hips. And that is really due, there's actually a ton of research, the elevation in hip bursitis with the decline in estrogen levels. Because you're losing some of the stability of pelvic floor, and there's more stress put on the outside of your hips.
So interesting.
Low back pain for everyone. SI joint pain for most people, are like some of the common ones. And yeah, but I would say also, just a quick point, although I'm a pelvic PT, if you work with a pelvic PT, that's not me, and they only look at your pelvis and only work on your pelvic floor, don't continue to see them, because your pelvic floor is designed to work in conjunction with the rest of your body. And so, I'm taking a full picture. I would say in that like 40 to 60 age range, plantar fasciitis is something I see all of the time. And women put it off and they're like, yeah, I've had pain in my feet for years. And I'm like, well, can you stand on your heels? Like, can you walk around barefoot? No, it hurts. And I'm like, well, we need you to be able to walk barefoot, even just in your house, right? That's the whole grounding, phenomenon. If you're always in the cushy Hoka shoes, you can never truly feel your feet because you're walking on a cloud all day long. And that's not good input for your brain. Your body will start to change because of that.
Wow,
So,
that's really cool.
Hope that answered your questions.
Yeah.
Yeah.
So at what point in time should somebody come see you?
Yeah. So I would say here's easy answer. When your symptoms are starting to affect your daily life and the things that you want to be able to do. As soon as you're second guessing, oh, should I go to that Pilates class or that yoga class? It's created pain. That's a good time just to check in with me and see if, like you said, Dabney, like we got your pain reduced enough. If it was pulling you out of something, you'd be like, oh, maybe I can go back to yoga and do that forward fold. So although this is hard because a lot of women just continue to push through, but there comes a point where you're like, I can't go to that class because I'm leaking and I don't want to wear a pad underneath my yoga pants. Right? Or I have to wear black all day, or I have to walk around with a pad on because who knows what's going to happen. That's changing your life around the pain. And my whole thing is I want you to be in control of your body instead of your body in control of you. So when that switch happens, that's a good time to seek help. If not sooner, but usually you've got to, sleep has got to be affected or life has got to be affected before you're really going to make the change. So
That's true. It's
Advice.
true. It's true in dentistry as well. You know, we're hygienists as well, but people will say yes to treatment when they have pain or if they perceive to have pleasure from something like whitening or veneers or something. If they perceive pleasure, then they'll say yes. Isn't it
Mhm.
sad that we are that way and we wait until something is so uncomfortable that's like, oh, I guess I'm going to go do it.
Yes. Yes. If I could just like screen a woman, after or through some of the big changes in her life, that would be great. That would be, that would be the best because then we can set a foundation or like coming up on the time of the year where everyone just jumps back in the gym. I'm like, just do a few weeks with me and we'll get you in a better place so that when you go back into the gym or your workout or whatever, you're starting at a better foundation. So I do think people are thinking more preventatively like that. So
Yeah.
hopefully that.
I'm just so glad that your work is so wonderful around women's health. I've had three children, three girls, and when my last one was born, I had three children under the age of 5. And so I had my children pretty close together, and there was nothing about pelvic floor. There was nothing I knew about anything for women's health. It was just you just you just keep going because you don't have a choice. You just keep doing all the things. And I was talking with a patient yesterday. I was like, I don't remember how we got to the grocery store. There wasn't pickup. There wasn't call ahead. It was physically you go to the grocery store, you pick out your groceries, and you come home and put them away. And that part of my life is a blur. Like I don't even remember getting it done.
Yeah. Yeah. We always live in the future. And I'm like, okay, I had to just remind myself to even like sit and chew my food yesterday without doing anything else. So it definitely, yeah, it flies by. There's always something more to do and something more to chase. And I try to remind myself that I'm like, this isn't just a to-do list I can check off everything because there's always going to be more adding behind it.
Yeah.
So yeah.
Sabrina's really good about mindfulness and being present. She reminds us frequently how important that is. And I'm glad to have her in my life.
I try. I try. I mean, I haven't always been like that. I was the type of person that was like, go, 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 take care of everybody, put myself last. And then I realized after some, time that, it's not selfish to say, okay, I need to take time for myself, whatever it may be, before it gets worse. Because then when it gets worse, you're not doing it with joy anymore, right? You're doing it from a painful aspect. And then it becomes like, oh, like I don't want to do that, right? So I realized that you really need to take care of you, whatever it may be. And, even if it's not taking that hour, but it's not in the end, it's not feeling guilty about it, right? Like it's about that if I do this now, I'm going to have more joy for it to give to everybody else and it will be better in the long run, right? And so, yeah, but I feel that. And I feel the whole pain thing with you. I probably should book an appointment with you because,
She's great.
I've been working with a lot of people. I fell down the stairs here at the lake and I think I did have a bit of a pelvic, like it jostled something. And so I've been working with someone that's getting better, but it's still that fear that you're like, I couldn't sleep on my side for a while. I couldn't do all these other things that I would want to do. And it was really saddening. And so I went to everyone. And then one doctor finally said like, oh, well, I don't, sports medicine doctor said, I'm sorry, I think you just need to work on your squats. And if it doesn't work, we can put you on some pain management. And I was like, I am not doing pain management because I know it's fixable. I'm pretty sure it's fixable. Like I was like, I'm young still, I'm under 50, but I was like, I know that this is like going to be okay. I don't want to go on pain meds. So I did work with someone that's getting better. So I'm glad, but yeah, that's what I think happens too, right? In the medical world, it's just like a quick fix. Everybody wants that quick, instant relief and onward. So I'm glad you're doing what you're doing and educating people and women, and it's great.
Yeah. Yeah. Thank you. Yeah. A tagline in my sessions is, I may have said this to you, Dabney, but it's actually do less. Because a lot of times, like, if just kind of speaking on, if you had a fall and you had, a lot of pain after that, and you already have time for mindfulness and stillness in your world, that's a good time to be able to do, say, like a body scan and go to those what have been painful areas and intentionally tell your body to relax those muscles or breathe into that. I mean, when it comes to the pelvic floor, that's really missed because we're like, okay, I can, unclench my butt, but how do I release my pelvic floor? But if you just sit there and you're, thinking about breathing into your pelvic floor, my number one cue is push your underwear away with your, you know what I mean? With your pelvic floor as you inhale. But just being able to say, and this is partially of, you've got to befriend the pain a little bit. You can't just be angry at it that it's there. And so it's kind of like befriending the pain a little bit. And as you're breathing, you're like, okay, I'm going to breathe right into where this pain is. And I'm going to find that stillness and that restoration. Because again, if it's, tapping into that fear, if you had a fall, did you fall downstairs? Is that what you said? Yeah. So then it's also like, okay, well, what does my body feel like when I approach the stairs? Do I get any sensation of, especially if I'm carrying something or whatever? And it's like trying to regulate. And a lot of that's done with breath, because your breathing instantly changes when your amygdala, when your fear center starts to drive. And so that's also how I'm watching my clients as I'm taking them through things. I'm watching their breath. And if they truly can't switch back to that nice calming breath, then I know that their nervous system is overtaxed. So I do think, it's so frustrating too, when you're trying to see all these different practitioners, and it can be simpler instead of more complex. So I just want to say this because I just want to shout this to the world, is quit chasing your pain all over, especially, and this doesn't have, you had a result of an injury, but in general, if you wake up with different aches and pains in your body, or a spot that comes and goes and comes and goes, quit chasing it and just start to lay the foundation of good health and healing of your body. And then, I'm a firm believer, your body will heal itself if given the opportunity. Because frustration, anger, those things elevate when you're trying to chase it and see all these different specialists, and you're not getting the attention that you deserve. And so that's kind of the medical system. And that's where I usually see women after they've seen multiple specialists and tried all of the things. And, you're not separate body parts, you're one whole body. So that's super important. Yeah.
Yeah. That's usually who comes to me. Is when people are frustrated with all the other practitioners and still don't feel well, still haven't got the answers, and are just so frustrated. Those are typically my clients too, who are just like, okay, I've tried everything else. What do you got?
Yeah.
Yeah. Don't you think like people just don't know like other methods, or they think, oh, that's a little hokey or whatever, and they don't want to go there first because they want to go with what they're taught or what we're used to or what we know, right? So they go to those things first, and then the doctors themselves, like if you go to your doctor, they're going to refer you to a specialist. They're not going to, oftentimes will be like, depending on your doctor, they may not work with the other methodologies and other people and other practitioners, right? They just go to who they want or in their system, in their healthcare system. Like here in Canada, we have a healthcare system. And I believe that, I don't know if I'm right, but I believe that each doctor has like a kind of a bubble. So they refer to their own group of healthcare professionals, right? So they only go to those people. And then if they tax out all those people, then you're on your own. You're like, okay, well, those didn't work. Now I've got to do it on my own, Right. So you start looking for someone where I know in the United States, maybe you have healthcare and stuff like that as well. I know you pay into sometimes some things, but if you don't have it, you trust the professionals, probably you would go there first. So it's good that we are bringing, that's what Dabney and I want to do with these podcasts, is introduce different methodologies, different practitioners, different ways of healing, so that people are aware that there are other methods out there for you rather than just the mainstream healthcare and wellness people, right?
Right.
Yes. Yeah. Right. I'll just tell one quick story. This is on repeat for me, is I had a patient who, did not want to have surgery, but she got to the point where she had a consultation with a surgeon, and, she comes back in and she's like, gosh darn it. Well, he told me I needed to have surgery. And I'm like, well, you saw a surgeon. So
That's what they do.
right. Or, and, same patient. And she's like, yeah, well, I talked to my behavioral health specialist and told her that this medication was affecting me, giving me this side effect. And all she did was recommend another medication for the side effect. And she was frustrated. And I'm like, well, these doctors are trained to prescribe pharmaceuticals. Like that is the basis of their training.
Yeah.
So even if they're trying their best with their wealth of knowledge, if they want to help somebody right in front of them and this person is complaining of something, their mind is automatically saying, well, this medication helps with that. So it's not anybody's fault, or, it's not that they're a bad person. It's just the fact that that's where their brain goes. Just like for you guys, it's like, herbs are so healing. That's where your brain goes when you're speaking to someone. Mm-hmm. And so, if you are someone that likes more holistic care, if you're tracing after that traditional medical model, you're not allowed to be frustrated when they recommend a medicine, because that's what they're trained in. They're trying to help you. It's just not in the way that, you might, because some people like, I'll take whatever medicine you give me. So I think that's just an important differentiation is, it depends what you want. You want the quick fix, or do you want the root cause? So
yeah, there's nothing wrong with it. It's just that, like you said, you explained it perfectly. It's just exactly what it is, right? That's what they're trained to do. And so my husband says that to me all the time. He's like, you go to the doctor, you want the answer, but then the person won't give you the answer that you were looking for, because you want a more holistic approach, and they're giving you more of the medical approach. And so like, you're going there, and I'm like, yeah, but you said go to the doctor, and I did. And then it's not like, you're right. It's not what I want to hear. So it's moving me in the right direction. So then I got to do my own homework. So I'm like, I should have just stick with my intuition and my, do my own due diligence. Right. So like you said,
and I will say women are letting go of their intuition more and more and more, because there's more distraction in social media in front of them and things like that. So the distraction is real, and it will send you all over the place.
A rabbit hole.
If you're looking for wellness, it's simplicity, not complex. You guys know, you're never going to make any change if you're trying to do all the things perfectly. And so it's really about simplifying it and doing the foundational things first. It's just hard to know the foundational things, but most healthcare practitioners understand that like hierarchy of your body and what should be addressed first. So,
yeah. And sometimes with clients who come in and are just so tense and so stressed, sometimes just, providing a tea that can help them relax and sleep better, like suddenly the things that they came in to see me for just go away. Yeah. Because they were so tense that other things emerged. But if you can get that tension gone and get them to relax and have a good night's sleep, the things that were bothering